We're asking state lawmakers to extend the lifeline of involuntary commitment to those struggling with serious addiction. The Compassion Interventions Act will give medical professionals the legal authority they need to transport someone who appears to be struggling with addiction to a hospital for evaluation and for support.
Welcome back to Inside City Hall. That was Mayor Adams giving an address at the Manhattan Institute today. He is proposing a legislative change to get people struggling with drug abuse off the streets and subways. It is part of the mayor's larger efforts to improve quality of life for New Yorkers. And joining me now to discuss the details of the proposal is a special panel. Dr. Mitchell Katz is the president and CEO of New York City Health and Hospitals. And First Deputy Mayor Randy Mastro is here as well. Thank you both for joining us tonight. So Dr. Katz, I'll start with you. The city's already doing this for people with severe mental illness, right? This now would be for people with an obvious substance abuse disorder who aren't necessarily mentally ill. Right?
But it's so much the same thing. In the case of mental illness, the person is hearing inner voices telling them to do bad things to themselves or others. In the case of the serious substance abuser, it's the drug that is causing their behavior. They're no longer able to make sensible decisions for themselves anymore.
So talk about how this works in practice, though, because I mean, it seems to raise obvious difficulties, right? How do you decide that someone on the street has a drug problem, right? I mean, that may not be obvious to someone who's passing by if there's no open drug use taking place.
Right. If there's nothing taking place, then the government has no role. We understand that people use drugs in their house. What we're talking about are people who are on the street and they are unkempt, they are unclean, they are behaving in bizarre ways. They're not clothed for the winter, and their issue is substance use. Sometimes it might look like mental illness, but under the current laws, once the drug clears, we would have to let them go from the hospital. What the mayor is talking about is a much more humane, compassionate approach that says these are people whose lives are being ruined by drug use, and they need treatment. And not everybody recognizes when they're in the throes of that addiction how the drugs are destroying their life.
And so, Randy, let me ask you, I mean, this is also being framed by the mayor as a quality of life issue, right? Because people who are using drugs on the street, it creates a sense of public disorder. I mean, it's almost like a broken windows type of approach, right?
Well, I would just say this, Bobby. Crime, major crime, down by historic proportions. Shootings lowest on record. Murder rate almost the lowest on record. There's been remarkable progress on major crime. Perception has to catch up with reality, and part of that is that people in their daily lives, they see others on the street, distressed or disturbed New Yorkers on the streets, and an overwhelming majority of those distressed homeless have addiction problems, and we're doing nothing about it. But this administration, since day one, has been committed to reaching out, a compassionate approach to try and help those in need on the streets get the services they need. For those with mental illness problems, state law, at our administration's urging, recently changed to codify how we can help those people. Now we need to do the same for the huge addiction population that's living on the streets, killing themselves, not able to get themselves help. We have to have a compassionate approach through state legislation that will allow us to help those people who can't help themselves.
So, Dr. Katz, let me ask you, I mean, there has been already some pushback from civil rights groups, the NYCLU. I just wanted to read you a little bit of a statement from Legal Aid Society. It said, forcing New Yorkers struggling with addiction into involuntary detention is traumatic, raises serious civil rights concerns, and does nothing to address the root causes of substance abuse. Moreover, the mayor's attempt to frame this as a quality of life measure is revealing, treating people in crisis as a nuisance to be swept out of public view rather than as human beings deserving care and dignity. So what's your response?
I'm a doctor. I'm not focused on the politics of this. What I'm focused on is the human pain. And while I agree, the best treatment, no question, voluntary treatment. And we offer voluntary treatment every day through our outreach workers. But there are a group of people for whom the addiction is so strong that it has taken over their life. And to those who say this is not a good approach, how do they feel about our current approach, which is open air drug use at our parks, on our streets, and people essentially destroying their life? Don't we have a responsibility to try to help them to have a life that is not ruled by drugs?
And Bobby, if I could add, I served on the board of the Legal Aid Society. I was the vice chair of that society for over 10 years. All right. I could not disagree more. They have a certain role in this process, so they're coming at it from an advocate's perspective. We're coming at it from a human decency perspective. The vast majority of states in this country have laws like the Compassionate Intervention Act that we're proposing. Governor Hochul had a very positive reaction today, so that makes us very hopeful about the future of this approach. And even friends here in New York City, council members, Councilman Yusef Salam said, "This is a bold and humane step forward in addressing the substance use crisis affecting too many of our communities. By equipping clinical professionals with the tools they need and expanding access to treatment, we're not only saving lives, we're restoring dignity." He spoke it so well.
There's a lot of different pieces to this. There's funding involved. There's millions of dollars. I also wanted to ask you, Dr. Katz, about something called contingency management, where you're actually providing incentives, right? You're providing rewards to people for maintaining treatment.
That's right. So again, the best approach is always voluntary. And so the contingency takes voluntary one step further. And it says, you're really addicted to these drugs. If you'll stay off this drug till tomorrow, I'm going to turn on your cell phone, and you can not only reach me for your care, but you can call your friends, you can call your mother. And then if you stay on another day, I'm going to get you a food voucher. And maybe you want to share it with your friends besides the food that we're going to give you here. And so you help people by building incentives. And part of the issue is that often when people are so addicted, they've lost any positive incentives, right? They've alienated their family, they've lost their job. And so the idea is to put back incentives. And I think that's a nice bridge to saying, and then if we can't get people involved in voluntary treatment and we can't, entice them through contingency management, then we need other solutions. And I just want to add, we're not talking about anything having to do with jail. We're not talking about, we're talking about mandating people get treatment. This is not an issue to criminalize drug use.
And Deputy Mayor, there's obviously a political aspect to this. I mean, this requires legislative action. You mentioned Governor Hochul's response to this. So this has to go through Albany, right? And it would have to go through session next year, and we don't know whether Mayor Adams is still going to be the mayor come January. So what happens to this proposal if he does not win re-election in November?
This is a proposal that should be widely embraced. And I am sure that Mayor Adams, when he is reelected, will see this through in Albany.
All right, and before we go, just a minute or so left, but Dr. Katz, I wanted to ask you also about Legionnaire's disease, which is obviously top of mind right now. I understand there's been a fourth death from Legionnaires. I mean, what is the status at this point? Because it seemed that the issue was under control.
Right.
Where are we now?
Well, the cases have peaked and are going down, and we recognize that hot weather tends to cause these kinds of outbreaks. All of the water towers in the zip codes that have been affected have now been remediated, which is where you use a decontaminant to clean out any trace bacteria that's left. So we're very hopeful, very sad about the loss of life, very hopeful that we've seen the peak of this epidemic. All right, Dr. Mitchell Katz and First Deputy Mayor Randy Mastro, thank you guys so much for coming in
and talking with us tonight. It is time now for a break.